Hi, this is Bella Mehta reporting for New Room Now from New York for the ACR 21 conversions. We have with us Megan Clowse, who is well known for her work in lupus pregnancies and lupus overall. And here's and we discuss one of her abstracts, which is patient perspectives on two distinct patterns of type 2 lupus symptoms. The abstract number is 1277. So, Megan, this is interesting work. I always wonder uh, what is type 1 and type 2 lupus? How do you distinguish it? I know this work was done by a couple of years ago, but it would be nice to have your insights.
Absolutely. So a couple of years ago, our group came up with this concept of type 1 and 2 lupus, really because, it grew out of our frustration of us feeling like we have lupus under control, but patients continuing to feel really poorly. So we started measuring disease activity and patient-reported measures, and really saw that they seem to be pretty independent, that the level of disease activity that the patient reported often didn't match what the doctor said. So what we called type 1 lupus is really kind of what all of us sort of classically were taught was lupus, which is, inflammation in the joints, the skin, the kidneys, that kind of stuff we measure and mark on our test. And then type 2 is more often what the patient reports, which is actually fatigue, myalgias, brain fog, really just feeling crummy, sort of this like flu-like feeling that so many of our patients just live with. So, so we started measuring both of them and have really found some interesting patterns from that.
So, in this qualitative study, what did you find? How did you? I mean, maybe you wanted to know more, get into more depth in this.
Absolutely. So, we were really curious as to sort of what type 2 lupus really felt like to patients and how they experienced it. And so we did an interview with 42 patients with all different types of sort of type 1 and 2 lupus activity, high, low, both of them together, one at a time. And then we did deep analysis. We had two rheumatologists as well as an epidemiologist who did the interviews and is very well versed in lupus. And our group read through them all very carefully. And from that, we really were able to kind of pick out two patterns of type 2 lupus that we suspect it feels better as two types, actually. So there's one that is the kind of, it goes up and down with type 1 lupus. So when their lupus nephritis and they're, is really active and they're really, really sick and they're getting admitted to the hospital, they're having a lot of pain, they're having a lot of fatigue, they feel really terrible. So there's that kind of type 2, what we now are calling intermittent type 2. And then there's more persistent type 2, which seems to be completely independent of type 1 lupus. And it's just they always feel kind of crummy. And sometimes they feel really crummy, and sometimes they just feel kind of achy, tired. And that one we call persistent now because it just sort of seems to always be there, even when you get their lupus inflammation under really good control. So when we really sort of picked out these two patterns, we now hypothesize that maybe they have two different causes, that maybe the one that kind of comes with the lupus activity and then goes away is maybe more inflammatory. And then the kind that just comes and stays, maybe that's less inflammatory.
True, and that's the one that is very difficult to treat and like manage. Um, Almost some of us label some of these patients as fibro type symptoms with lupus.
Mm-hmm.
What do you want people or rheumatologists or patients to take from this?
Yeah, so we used to call this fibromyalgia in our clinic. And what we found was that, we would tell people, oh, this isn't your lupus. Your lupus is really good. This is your fibromyalgia. This isn't your lupus. Your labs are fine, right? And that was really disempowering to our patients. And it didn't match with their lived experience. Like all of our patients say that the fatigue, myalgia, the brain fog is their lupus, right? That's their lived experience. Maybe it all came up at the same time. I don't know, but they all firmly feel that it's their lupus. And so this back and forth of it's not your lupus, it's something else, just led in our clinic to a lot of discontent between both doctors and patients, right? We just felt exhausted at the end of the day, sort of almost fighting with our patients. So we really found that this language really kind of gets us all on the same side, right? And we still sort of say, your type 1 lupus, looks great. And that's such good news. And you're taking your medicine and your labs are looking great. You still have this type 2 lupus. And And I know everybody wants me to tell them what to do for it. I don't have the perfect solution for it. I do the same stuff that everybody else does, exercise and therapy and, sometimes antidepressants, that kind of thing. But we found that just a change in the language and really sort of like getting on their side of like, this is a part of their lived lupus experience has really changed our relationships with our patients, and their receptiveness to our suggestions actually is definitely better when we couch it in the words of lupus.
No, I totally agree. I think lupus patients sometimes have this frustration that is going on for many years. Doing qualitative studies like this, getting into the depth of what the patients feel, getting into the patient-reported outcome measures is definitely important. Thank you so much for your time. And please follow us more at Room Now. And this is Bella_Mehta if you want to follow on Twitter. Thank you.
Thanks.